to the PPE. Physical layouts, of course, were challenging for us. And you guys in the hospitality industry particularly saw this, particularly those who had restaurants or any sort of food service establishments. That physical layouts have become quite an interesting challenge to get around, and I know it's been very difficult. Working from home is another thing that has come up out of COVID, and we'll talk a little more about that, as well as the whole mental health aspect. And we know mental health is high on the radar right now, worldwide, and has been before COVID. And COVID has just, I guess, added fuel to that fire in some cases. So let's talk about some of the different pieces. So the supply shortages, obviously, the first ones we saw was the masks, because everybody wanted N95 masks. So there was mass supply shortages of N95 masks. They were being held back for the medical use, because those are the folks that needed to have them. Now, something you need to understand about N95 masks is N95 masks are true PPE. And when I say true PPE, PPE is intended to protect the wearer of the product, of the device. N95 masks are intended to protect the wearers of the product. Hence, the definite need for those in the healthcare industry dealing with COVID patients to be protected from the virus themselves. But we also saw mass shortages of toilet paper, obviously, but also of wipes, sanitizer products, and things like that became very difficult to come by. So again, I give full credit to the manufacturers and some of our own local folks in the distillery businesses that, again, pivoted their operations and started producing sanitizer products and alcohols that could be used as sanitizers in the workplaces and all across the province. So bravo to them, because that was a remarkable effort put in by everybody to do that. But some of the things we didn't always think about were more around the idea of business continuity. So what other consumables do we use? And are there going to be problems with supply chain as a result of these things? So I know many of the clients we've worked with had challenges there. They might have had relied heavily on suppliers out of the US. And all of a sudden, US shipments became very, very slow or non-existent, which put them in a very bad place. So planning for things like the other products that you need, besides just the obvious PPE and sanitizing products and cleaning products, but all the other things that you need to run your operations, keeping a plan for, again, essentially for business continuity purposes of, are those supply chains going to be affected by a pandemic such as COVID-19? And if so, what is our backup plan? So do we have contracts in place with organizations that have stockpiles that will set aside for us in some cases, things like that? So do we have alternate sources to supply us with the items and things that we need? And how do we get those to us? How do we get those products to us? Misinformation. Again, there's a lot of misinformation out there regarding COVID, that it was airborne, that just simply being in an area, you could breathe this in. The other one was the immediate knee-jerk reaction towards gloves, and everybody wanted gloves. And while gloves are an effective means to prevent contact with your skin, there's some evidence to show that a glove use, again, if you use the wet paint analogy, if I've got gloves on or I got bare hands and I touch a surface of wet paint, I've now got paint on that surface. I'm much more likely to wash my hands than I am to wash the pair of gloves. So what was happening was people were wearing gloves and they were getting a false sense of security that these gloves were protecting them, when in fact, the gloves were contaminated at first contact with any contaminated surface. Then now I have a contaminated surface that I'm carrying around, and everything I touch from there on gets contaminated unless I wash it. The most effective means, as they harped at, was wash your hands. Uh, the trouble is when you wear gloves, the tendency is not to wash your hands because you feel protected by the glove. But the reality is what you're doing is everything you touch, you're spreading that to the next surface, to the next surface, to the next surface. So gloves really good for like when cleaning, and some of the cleaning products are quite harsh. So you will see on the information sheets and the instructions for many of the cleaning products, they will advise to wear gloves to protect your skin from the products. Um, just to be aware that just because you have a glove on does not mean you can't transmit the disease. You can't move it from surface to surface because, again, it's still wet paint. It's on the glove. It's going to be on everything you touch with that glove. So keeping those things in mind as you go, as people go along. And again, people didn't always understand how that worked, so it caused a lot of issues. Um, Communications. It became abundantly clear that communication was so important so that we could clarify what information we needed to provide to our staff, to our employees, that we needed to provide to our customers. That communication it was extremely important, and it you head off a lot of this misinformation with good communication, and you quickly shut down or try your best to shut down that rumor mill that spreads very rapidly. Cleaning, sanitizing, and disinfecting. So here was one that, again, um, there's a difference between those three things. They're not the same thing. Uh, Cleaning, so I'm wiping off surfaces. That removes some germs. It removes dirt and impurities off the surface. So I wipe off a desk surface with soap, with water or soapy water or something. That does some cleaning. Sanitizing is the next level. So sanitizing often includes using the, like I say, the alcohol wipes and the sanitizers we use on our hands. They kill most of the germs and bacteria, but not all. So they're not 100%. They do a better job. They're generally for instant use. So you use them immediately. You put it on, you wipe it off, and that's your sanitizing. True disinfecting is at another level again. So a true disinfectant usually has a latency time, or a time that you put it on and you have to leave it for a certain period of time before wiping it back off again. It's not a simple wipe with a wet wipe. It's a product that you spray on and then you leave for a period of time and then you wipe off. So that kills a greater proportion of the bacteria and germs that are on the surface because it has more time to act. They're sometimes harsher chemicals, but they have good long-term effects. But understanding there are three separate levels, and sometimes that was an issue for people to get a real handle on what that meant. Again, PPE, I mentioned this earlier. True PPE in the technical sense, by regulation, by the OHS regulations, is intended to protect the user of the article. So if I wear an N95 mask, which is true PPE, it is intended to protect me from particulate or from the atmosphere around me. The same way as if I wear steel-toed boots, they're meant to protect me as the wearer of that boot. They're not meant to protect you as the person around me. It has no impact on you whatsoever. The surgical masks and the community masks or the homemade masks or all of these masks that we're being asked to wear today, again, this is where misinformation comes in. They are not intended to protect me as the wearer. They are intended to protect you as the person around me. And this is where, again, you see these arguments for people who are, anti-mask and don't want to wear the masks. And, I feel perfectly safe. I have a strong immune system. I'm not worried about getting the virus. You don't wear the mask because you're worried about getting the virus. You wear the mask because you're worried about me getting the virus in the room with you. And this is the part that, again, people don't always understand. Those masks are there to protect those little droplets when you speak, when you sneeze, when you breathe. If you could see it on a microscopic level, there are small droplets being released from at all times when you're breathing and speaking. Those masks are made to trap those, to catch those before they go out and land on surfaces or land on people's clothing and anywhere where they can touch and come in contact with them. That's the intention of those masks. They are not to protect the wearer. Very important to understand, because in order to protect the wearer properly, they have to seal really, really tightly around the face. None of these surgical masks or just these homemade masks provide that level of seal. In fact, by regulation, again, PPE is covered under OHS regulation. By regulation, if you're wearing a true N95 mask, a true PPE, then you're required to, that triggers all kinds of requirements under the regulations. It's not as simple as handing them out to everybody and having everybody wear them. Because if you're issuing PPE, true PPE, to employees, they require training on how to use that PPE, how to properly fit it to their faces, how to properly wear it, how to properly clean it, how to properly handle and dispose of it. They're also required to have what they call fit testing, which is a process where we actually check, we use a hood kind of affair to check for leakage around the fit of the mask. And if there's any amount of leakage, that mask doesn't fit and you have to use another type of mask in order to get a proper fit. It's referred to as fit testing. That's required by law for PPE. For any sort of respiratory PPE, that fit testing is required by law. Again, we don't, most of us in the, in the non-medical, non-industrial fields where we need true respirator PPE, we want the masks that the government's telling us we all have to wear in public places to protect each other, not ourselves. Those masks do not require all of those hurdles to be jumped over. So again, be aware, if you're issuing an N95 mask, in theory, a regulator could charge you for not using the proper controls around PPE if you haven't done the fit testing and all of those type of things. The other thing to remember, and I saw this, it's funny because I was just took my mom to the hospital or to the doctor's office the other day, and sitting in the lobby was a gentleman with a proper N95 mask on. Now, some of the N95 masks are just those paper kind of, they're all paper all the way around, but you'll see some that have like a little valve in them. What people don't understand is this gentleman was sitting there with one of these masks on with a nice little valve in it. And that's great as true PPE. So it's doing a good job. When he breathes in, all of the air going in is being filtered through that mask. When he exhales, it goes out through that little valve, that little circular or square valve in the mask. The trouble is that's non-filtered air. What he's exhaling is non-filtered air. So that doesn't protect me at all. And it doesn't protect anybody else in that doctor's office. He's essentially not wearing a mask as far as we're all concerned. If you have that vent there, that's direct ventilation of that exhaust, for lack of a better term, from our breathing. So those are not the ideal thing to use for the purpose that we're trying to wear them for, again. So there's a whole variety of different things around masks that caused a lot of confusion and misinformation. Gloves were another one, which I spoke about. I already talked about the glove thing. Shields, again, a lot of people, you'll see people wearing shields. Shields are better than nothing, not as effective as the mask. And why? Because the shield still allows a lot of air. So if I sneeze, or even when I talk, a mask close to my face is capturing a lot of those droplets, the majority of those droplets. Very little is sneaking out past the edges and things, because the materials are generally cotton or materials like that are quite absorbent, and they pick up those droplets. They attract and pick up those droplets really well. A shield protects from larger droplets that may be projected, and it sounds terrible talking this way, but projected straight out and hitting the shield. That's great, but there's still a lot of material that is going back, down, up, around that open gap, right? So they're not nearly as effective as a mask. I understand there's reasons some people can't wear the mask for respiratory reasons, or challenges with claustrophobic type tendencies and things like that. Uh, so they make that's an alternative to them. It's not as good, but it's better than nothing. It's still risk management. It's still lowering the risk. It's better than wearing nothing, but it's not as good as wearing as wearing a surgical type mask. So again, it's understanding how this think about how the things are moving. Again, it's logical when you think about how particulates moving in the air, that the bigger the openings, the more particulate's going to get out. That's simply the way it works. Physical layouts of buildings and businesses. When we reopening here, trying to get the physical layouts, and I know it's been an immense challenge to people. We've seen the arrows on the floor and directional arrows and barriers and signage to try to get people to move in the same direction and to separate the markings on the floor when you go to the grocery store, and they trying to get you to separate in the lineups and things like that. Very well done. I've seen some creative solutions in some of the hospitality areas recently, where they've started putting barriers between tables. Again, it's not absolutely perfect. Are you within an absolutely sealed bubble sitting at your table? No, but that barrier still provides some barrier to those droplets transmitting from one table to the next. The social distance, that's the idea of the social distancing, is 6 feet generally protects for a large percentage of the droplet transmission. So if you could, you might have seen some of the reenactments or things that they've done with science to show how droplets spread visually. And 6 feet captures the majority of things. Now, if somebody sneezes, it can project a lot further than 6 feet, or a cough can project further than 6 feet. But for the majority of things, 6 feet or 2 meters, ironically, which are not the same thing, but they're close. The idea is to get that social distancing, because it again, reduces that risk down to a lower level. It's not perfect, but it's better. So managing our spaces that we have has been challenging for a lot. Understanding how much capacity we can have in rooms. I can tell you at our place, our classrooms went from capacities. One classroom had a capacity of up to 20 people. The other one was 25 people, and they're now 5 and 6. Just in order to get the social distancing, you just can't put as many people in there unless you were using barriers or things like that, or other methods. So again, it's that these are some of the challenges that we had to deal with. And then the question around, how do we deal with people that are not following the rules and violating the rules? So that's been a challenge. And I know some of staff in some areas find that really difficult to tell somebody that they can't come in without their mask on. As employers, we just need to back them up and tell them that they do have the authority to do that. And if somebody questions it, they're more than glad to, we're more than glad to step in. Management or supervisors more than glad to step in and explain to this individual why they can't come into our facility without their mask, without using the proper controls. So those are some of the challenges that have come around. Working from home has been another one. So many businesses had the ability sometimes, and again, in the hospitality industry, a lot of times you guys didn't have much of this option, but a lot of businesses pivoted and sent people to work remotely from home. But that created a new issue. So again, the OHS Act we talked about the other day, it defines a workplace as anywhere where you do work on behalf of work. So, and we're responsible to ensure the health and safety of people at or near our workplaces. Well, if my workplace is now my basement, then my employer has a certain obligation to ensure that my basement's a safe place for me. So that's caused a little bit of challenges for organizations to understand that when we sent people home to work, we can't necessarily make the assumption that they have safe working conditions at home. So the question is asked, like it's great for the first week or two to sit on your couch in your PJs and work on your computer. That was lovely and comfortable and nice for a few days. But if you do that 8 hours a day, 40 hours a week, I guarantee you will have neck, back, shoulder problems as a result of that, because it's not a good working thing to be in at extended periods of time. So it will cause issues. So that standard of care to our employees has to extend out to those home offices and those home workplaces. So how do we manage that? You know, how are we going to look after making sure that those spaces are also protected? And last but not least is the whole mental health thing. And we've seen how this has had significant effects on some, moderate effects on others, and virtually no effect on some again. So with mental health, it's not the same as traditional safety hazards that we're used to dealing with, in that the same mechanism of injury can affect three people in three completely different manners. We need to stay on top of that. This caused a lot of stress and turmoil for people for a whole bunch of reasons. There was, fear and concern. There was lack of contact for people. There was lack of contact with family members, which brought on all kinds of issues. There's lack of contact with our work, with our social networks at work. And that's, that has definite mental health issues for people and can bring on things. So as employers, again, we can't necessarily cure everything, but what we can do is try to keep people informed of what's going on. It helps to minimize the stress. We keep people involved and keep them, involved in decision making, in how asking them questions and keeping them involved. Set up things that allow for regular check-ins or even social things. I know one of the things we did at Safety Services was we had a Friday cocktail hour, we referred to it, and it was a Zoom meeting, and all staff were invited to it, and we had really good attendance at these. And it was like a Friday evening at 4 o'clock. Everybody kind of came on and just it was a chance to debrief and talk with each other and just be social. That it encouraged that social support network that is so necessary for so many of us. Again, help people with coping strategies and provide them with resources. There's lots of resources out there around mental health. There's helplines, there's papers you can read, there's all kinds of things that can help people with these. A lot of companies have EAP programs that can be extremely beneficial. Again, reminding employees, because a lot of times the EAP programs, employees don't, kind of forget they even exist if they're not using them. So reminding people that those programs are out there, they're paid for, and there's those resources are out there if you need to talk and encourage people to take advantage of those resources. Again, there's some links to some various resources that are available out there on the mental health side of things, that you can feed to people, that you can provide to your employees if you haven't already. These can be really helpful to help people get through this, a challenging time. It's been a very difficult time, and again, some it affected more than others. Some of us, don't like. Admittedly, I must say I'm not somebody that I'm quite comfortable working by myself, and working in my little basement office and things like that. It doesn't, I'm used to that. I've done that for many, many years, and it doesn't really bother me, that distraction. Now, I have my family with me in my home, so I have that support network. I have my dog who stays with me every day of the week, who's under my feet every day of the week. My little stress relief that comes over and nudges me every once in a while, to remind me to turn off for a minute. But those are all the little things that affect people, and we need to keep in mind. So when it came to COVID's an interesting exercise, and I'm sure will go down in history in the business world and in the psychology world of how people reacted and how people managed with a pandemic like this. And you know what? I hate to say this, but the reality is this may happen again. If we get through this one, you may say something. We may see something like this down the road again. So this is, to me, this is a practice exercise. This is a first test, and see how we manage through this. But we can be a little better prepared for the next time. Early on, I had this discussion with my president CEO. I said, we're going to be looked at very closely as management of an organization. Our staff and our clients are going to be looking very closely at how we deal with the situation, and that will reflect on what they, this is kind of where companies get to show their true colors. Where you get to see the true colors is how they react in crisis situations like this. And you've seen it in history, not necessarily with pandemic things, but you've seen it with how organizations manage in a crisis, and whether they're successful and they come out of it shining like a shining star, or they are, they're devastated and they never bounce back. Their reputation takes such a hit that they never bounce back. You look at Maple Leaf Foods when they had their biggest listeria outbreak, and the way that was handled, where they, the CEO got on TV and told everybody that, it was open, honest, told them what happened. This is, that we're at fault. We're getting in control of it. That was not something, I'm told, that was recommended by his communications people, but it was a brilliant leadership thing. And what it did is it took an episode that very possibly could have destroyed a major company to never be able to come back again, to being stronger than ever. So again, sometimes in how we respond to situations really reflects strongly on the leadership of organizations and the culture and the beliefs of organizations. So, as leaders, we need to communicate exceptionally well with everybody, our employees, our clients, everybody around us. We need to reflect that we're positive, but not unrealistic. So you need to be realistic, transparent about what's going on right up front, so people know, because a lot of the problems come from people not knowing and unsure, and they're concerned for their jobs. They're concerned about what's going to happen in the future and things like that. So being clear, upfront, and transparent with people really helps. The basic empathy and understanding how that this doesn't just affect the organization, that the organization is actually a bunch of people, and how those people are going to be affected. Again, thoughtful response, not reactive, responsive. Responsive rather than reactive, if that makes sense. So when we, again, a lot of companies reacted early on and went into panic mode, where others were more responsive in that they did their research, they did the math, they figured out what they needed to do, they put a plan in place, they implemented that plan, they communicated that plan to all the employees so everybody knew what was going on. They quashed a lot of this misinformation and rumor mill that spun up very, very quickly. Got a hold of that early in the thing and managed it through. And they've got, what I can say, in a lot of cases, what you ended up with was, instead of resentful staff that they lost their jobs, or that there was cutbacks in their hours or whatever, what they got was staff that are even more dedicated now than they ever were, because they saw that we really stepped up to the plate and we gave them the opportunity. We got them involved. We communicated really well with them. We didn't sugarcoat it. We were upfront and transparent about what's going on. You know what? We don't know whether we're going to make it through this or not, but we're going to do our very best, and we're going to keep our nose to the grindstone. And this is the strategies we're going to use, and this is how we're going to do it. And those type of things. But the communicate again, you can't over communicate in these times. The more stressful the time, the more you have to communicate with everybody, with your staff, with your management teams, and even with your clients and suppliers, so they understand what you're doing, how you're doing it, when you're doing it. And it starts to put people's minds at ease that you're managing this, that you've got control of it, that you are going to come out the other side. You're not flailing in the wind trying to figure out what you're going to do. And again, I think you'll see that it will reflect how organizations responded to this will reflect in the future. But let's face it, not all of us, nailed that right off the bat. And in all fairness, we've all made mistakes. But again, I think maybe it's the glass is half full side of me, but I look at that as an opportunity to look back now, because right now is a good time to reflect, because things have relatively stabilized. I wouldn't, this second wave is undoubtedly coming. You're seeing it in other parts of the country already. But I think it's a chance for us here in our little Atlantic bubble, where it's such a wonderful place to be, to sit back and reflect on, well, how did we manage the first wave? And what things could we do differently this time around that would be better? How could I improve my communication? How could I find better sources of information to make better decisions based on? So again, thinking about how can we make improvements, have a hard look at how we managed the first wave, and think about how we might manage the second one. And then take some notes of those, because who knows, maybe in 3 years, 5 years time, we may be back in a similar, maybe different situation, but another crisis situation. That these kind of things, these learnings from this past, this last run through, can really do us a lot of good the next time around. So keeping those kind of things in mind, I think are important. And I think this is, again, maybe it's the glass is half full in me, but I look at these things as opportunities, because I think we can learn a lot from them that we can take forward into the next, the next time. Hopefully we never have to use them again, and maybe we won't. But if we can learn from them, that's all things that I can put in my back pocket under my experience envelope, my experience file folder, that I might be able to draw on again down the road at some other point. I want to thank everybody. I think I ran a little bit over, and I apologize for that. I'm going to turn off the screen share here so I can see if there were any questions or EAP. So somebody asked employee assistance programs. So some organizations will have employee assistance programs. It's kind of like an insurance policy that goes through a lot of the healthcare providers that provide things like they might provide some legal services. They might provide some psychological services to their employees. They might provide, a variety of different things. A lot of them provide even simple things like how to buy a house, like how to do the paperwork around purchasing a home and things like that. Like they have a lot of different support mechanisms built into these employee assistance programs. So I apologize for the acronym. I'm glad somebody caught me on that, because we do tend to use a lot of acronyms in my world, and I want to be conscious of making sure I explain what they are. So I hope that's clear. You can look into these programs. They're even available on small scales for smaller organizations in some cases, and they can be quite beneficial on a whole bunch of different levels of things. Are there any other questions? Not seeing anything in the chat box right now. If there's no other questions, I'll hand it back to Nicole. And again, I want to thank everybody for attending today. And again, if you have any questions, you've got my contact information. Feel free to reach out, and we'll see you next week. Nicole, back to you.
Okay, thank you. On behalf of TIANS and the Nova Scotia Tourism Human Resource Council, I'm going to thank our presenter, Joe, and to all you for attending session 3. You can complete a survey feedback form online. So right now I'm going to type that into the chat function. And please fill that out so that we know what topics to cover in session 4. Up next is session 4 in the Health and Safety Certificate series. And this session is going to cover your burning operational health and safety questions that you've been asking in the webinar feedback surveys. So stay tuned for the session title and description, which will be released in the coming days. And we urge all attendees also to register for the final session at nstourismstrong.ca/health safety certificate, which is also posted in the chat function now. And another reminder to indicate your interest in individual gap analysis sessions with Safety Services Nova Scotia. Again, in the webinar feedback survey, you can actually indicate your interest. It is free. Tyans is supporting all operator costs for the one-on-one session through our Tourism Reactivation of Industry program. So thank you all again, and we will see you next week for the 4th and final session. Have a great